Kia ora koutou. I'd like to welcome you to the first evidence to practice session. Um, I'm going to get us started with the karakia, which is about calling in positive energies from all directions for our hui today. Tūtawa mai I runga, tūtawa mai I raru, tūtawa mai I roto, tūtawa mai I waho, kia tau ai te mauritu, te mauri ora, ki te katoa, haumie, huie, taiki. It's fantastic that you've joined us here today. Ko Cheryl Han Tokuingwa. I'm with the Puna Aonui business unit and really happy to be your facilitator today. Before we get started, I've got a couple of messages. I just want to remind you, in this version of Teams that we're using today, you're only going to see the presenters, so you won't be able to turn on your camera or chat, but you can ask questions through the Q&A function. Today is our first evidence to practice session, and to mark that, we're first going to hear from the Puna Aonui Chief Executive, Emma Powell, and then we've got Professor Michael Salter presenting for around 15 to 20 minutes, and then you'll have a chance to ask questions, and those questions are going to be facilitated by Sate Ete from the Puna Aonui business unit. We'll try to get through as many questions as we can. So I just want to remind you that we want this to be a safe and inclusive space. The sessions that we will have will be covering the topics of sexual violence and family violence, and these may be difficult or distressing. So please do what you need to do to look after yourself and to get the support if you need it. We're going to post links to the help portals available in Aotearoa where you can phone or online chat, or have a look at the website for more information about services and supports that are available in your area. Lastly, feel free to send us any questions, feedback or ideas. We're going to post our email and our website up during the session so you can follow that. And we'll also have a recording of the session available on our website soon. So now I'd like to literally hand over to Puna Aonui, Chief Executive.
Well, kia ora koutou, everyone. It's really awesome to have you all together for our very first evidence to practice session. And I just wanted to say a big shout out to my team as well for both having the brainchild of bringing this together, but also for arranging for Professor Michael Salter to be part of our discussions today. What a great way to kick this off. Had the absolute pleasure of meeting Michael last year in Australia, getting crunchy about outcomes, and he has helped us along the way when we've been thinking about measurement and all things complex trauma, and particularly childhood sexual abuse. So really awesome to have him here today. As you know, Te Puna Aonui is a collective collaboration, all the Cs of government agencies working hard to really transform the system for family violence and sexual violence, and ultimately to make things better for people. That's absolutely why we're here. And those people who make it better for people are you people. And I just really wanted to take a moment to acknowledge the hard work that you are all doing in the front line. It might be in a back office, it might be working with whānau, it might be working to enable the system, but I know you are doing the hard yards on behalf of a number of whānau out there and working really hard to make that happen. So I'm so pleased that we could offer you this break and moment in time to start to hear about some evidence and then how we start to help to translate that into practice. These practice sessions are going to be happening monthly, and we are going to have a series of speakers and a way of informing you through what is the data telling us, what is the evidence and insights that we can start to bring through into our practice. We've been updating our website with more of our family violence and sexual violence data and information, and a number of you will know that we recently undertook Champions of Change or workforce survey to understand those experiences for you, in particular our kaimahi working out there in the sector. And we're going to be publishing those results soon as part of our outcome and measurement framework first report later this year. We're also really proud to be funders and support for the New Zealand Family Violence Clearinghouse, and I know a number of us lean on that amazing resource, almost on the daily, for going deep into what is the best practice, research evidence and data that we can be gleaning for not only here in Aotearoa, New Zealand, but also internationally for supports for how do you turn that evidence into accessible and practical application into our work. So that is absolutely what we're trying to support here today as well. I'm about to hand over, but I'm not. I'll virtually take my headset off and give it to Michael over there in Australia. High tech here in Puna Aonui. But just really wanted to warmly welcome Professor Michael Salter, who's the Director of Childlight, based in the School of Social Sciences at the University of New South Wales, Australia. As I said, had a great opportunity to connect not only with Michael, but a number of professionals, academics and survivors last year in Australia, understanding sort of how do we measure impact against the Australian National Plan, all really relevant and hot topics, I think, across the ditch for us. Have always appreciated the depth of information analysis that Michael has shared with us. I think, Michael, you're doing some really terrific and front-leading work, particularly about how do we understand trauma and different ways of approaching really at the heart of intergenerational shift and change that we need to see, particularly for our whānau who have experienced trauma. And so very happy that you're here to kick us off for our very first evidence to practice session. So over to you, Michael.
Wonderful. Thank you so much for such a warm introduction and for the invitation to speak to everyone today. And I think really just to echo that sentiment about the incredibly important work that everyone on the call is doing, and really pleased to just get the chance to have this yarn with you. What I'll do for the next 15 minutes or so is just share the outcomes of some work that myself and my team have done for a couple of years now. We conducted the world's largest perpetration prevalence survey of child sexual abuse. So a lot of what we know about how common child sexual abuse is in the community comes from asking adults about what happened to them when they were kids and whether they were sexually harmed as kids. So that's really important information. It tells us how many survivors there are. It helps us understand the impacts and their needs and their outcomes. But what it doesn't necessarily give us a good sense of, and there's been consistent debate on how many perpetrators are there in the community and who are they. And so for the next 15 minutes, I'll just, I suppose, give a little bit of a taste of that we've gathered. I don't want to give you a deluge of data, but that's probably what's going to happen. I think at a high level, it'd be really useful to just take on board, I think, some of the themes that have come up from our research findings, and then Sati and I can have a conversation about what the implications are for policy and practice and just how we conceptualize child sexual abuse. So just one moment while I share my screen. Okay. So firstly, this is actually a collaboration between myself and my team, and then Stop It Now, based here in Australia. So some of you might be familiar with the Stop It Now model, which is intended to be an early intervention service for people who are concerned about their sexual feelings and behaviours towards children. And so Matt and Georgia really brought a lot of clinical as well as research expertise to the project. And the project also was overseen by an advisory group across government and civil society, including people representing lived experience. And our aim was to really understand very simply how many men are there in the community who have sexual feelings towards children and also want to sexually abuse children. We focused specifically on men in this study, recognizing men are the majority of sexual offenders against children if we were to run a survey to look at women and women's sexual conduct with kids, the survey would look quite different. We know that the risk factors for women's sex offending is not the same as the risk factors. There's some overlap, but there's significant differences when we look at who female sex offenders are. This is the boring stuff on method. We put a survey together, we reviewed the literature, we asked a range of questions. So demographics, we asked about the men's online behaviours, we asked about their health and their well-being, including adverse childhood experiences. We asked about their attitudes to the sexual abuse of children with a focus on online offences. We asked about pornography and their access to child sexual abuse material, had any sexual feelings towards children, and then any online or offline sexual behaviours towards kids. There's research going back probably 40 years, which shows that people are pretty honest in research about their sexual fantasies or illegal sexual behaviour in surveys, as long as they know that the survey is anonymous. As long as they know that they're not going to get into trouble, there's pretty good data to say that they tell the truth, basically. And so this was a survey that was conducted through an online platform across Australia, the UK, and the United States. And we were able to gather nationally representative samples in those 3 countries. And so what that means is that the survey findings that I'm going to present to you are generalizable. They tell us about the prevalence of this behaviour in the community. Some limitations just in terms of the fact that we were going through an online survey panel. So people had to opt into the panel. It's quite a large panel, about 1.5 million people participating in the survey panel. But it is in that respect, not like a gold standard survey. That sort of survey is extremely expensive. There's always a risk in these sorts of surveys that people are speeding through the survey. They're filling it out very quickly. Or they might not be telling the truth, but we had quite good quality assurance measures in place. Across the 3 jurisdictions, there was variations in the age of consent, and so we just took the international legal definition of a child. As a child was anyone under the age of 18. For online offences, that's pretty much the case in law anyway. There's some variation, but again, when we reviewed our data, we're quite confident that we haven't exaggerated the rate of contact offending. So just to get into the interesting stuff, in terms of men with sexual feelings towards children, we asked 6 questions. We asked people if they had any sexual feelings towards people below the age of 18. But we also asked some other hypotheticals. So, would you sexually abuse a child between this age range if you knew that nobody would find out? We also gave men a slider on the screen, and we said, what's the lowest age that you usually find attractive? And they could take that slider under the age of 18 if they wanted to. We asked 5 questions about sexually offending against children. So intentionally viewing CSAM, grooming a child, webcamming with a child, paying for sexual interactions or content of a child, and sex or sexual contact with a child. I want to be clear, the data I'm going to present does not contain information about sexually harmful behaviour for the most part. That in a moment. We are talking about what the men did over the age of 18 in relation to people under the age of 18. So this is on offending across the 3 jurisdictions. So any child sex offending, sexual contact with a child, online grooming, viewing CSAM, sexually explicit webcam, and paying for sexual content. So that's child sexual exploitation. What we're seeing is broadly equivalent rates between the UK and Australia and much higher rates in the United States. So about 1 in 10 men in Australia and the UK had committed a sex offence, but much higher rates on average in the US. And that pattern persists, particularly once we get down towards the end of that graph and we're looking at very serious online offences, sexually webcamming with a child or paying for sexual content. In the US, this was 2.5 times more frequent. However, because it's a comparative study, we were able to look at why. So in multivariate analysis, what explains the difference between the jurisdictions? Why is offending so much higher in the US? And I think this is really interesting because towards the social and the commercial determinants of child sexual abuse. So the factors that explain the difference in sex offending between the US on one hand and the other two jurisdictions was two things. Adverse childhood experiences are much higher in the United States than they are in the other two jurisdictions. And also the men's online behavior in the US was substantially more deviant. So they use the internet more, but what they used the internet more was really, what they used the internet for was quite concerning. And so if we're thinking about the social determinants of child sexual abuse, I think we've got two important lessons here. Firstly, adverse childhood experiences increases the proportion of men who are a risk to children. So we're seeing that intergenerational transmission. And then secondly, the online environment and the extent to which it is regulated. The internet in the United States is much less regulated than it is in Australia and the UK. And our data suggests that those online policy settings have a direct relationship to the prevalence of perpetration in the United States. This is data looking at a pooled sample, so almost 5,000 of the men who we surveyed. And what you see is a dose-dependent relationship. The more frequent adverse childhood experiences was in the life of a man when he was a boy, the higher the risk that that man was going to sexually offend against children. Now, bear in mind, we've got a group of men who have no childhood adversity whatsoever, and they are sexually abusing kids. But when we look at men who have all 10 adverse childhood experiences, so that's an extreme abusive and neglectful childhood, over 40% of those men had committed a sexual offence against a child. When we start to break that data down in a bit more detail, what we find is that being sexually abused as a child increases the likelihood of sexual feelings towards children. However, adverse childhood experiences, it doesn't have that same relationship with sexual feelings. There's like a threshold, particularly with sexual abuse for some boys. It's not as though the more adverse childhood experiences somebody has, the increased likelihood of sexual feelings they have. So sexual abuse has some relationship with this. It's not determinative. We know that the majority of boys who are sexually abused do not go on to have sexual feelings towards children, but there's a cohort of boys who are vulnerable to this. However, being sexually abused as a child plus other adverse childhood experiences increase the likelihood of sexual offending against children. We took a look at three groups of men. So there's a group of men who have sexual feelings towards children, but they haven't acted on it. There's a group of men who have sexually offended against children, but they don't report any sexual feelings. And then there's a group of men who have both sexual feelings and they have offended against kids. And what you can see is that that was the substantively larger group in the United States compared to the other two jurisdictions, almost twice as many men reporting both sexual feelings, but also acting on those sexual feelings. And we were able to disaggregate what do these different groups have in common? What's the profile of these three groups and what distinguishes them from other men in the community? The men who had sexual feelings, but they hadn't acted on them, on average, compared to other men in the community, they were younger, they lived in the city, they had lower incomes. Lower incomes could just be related to young age. You know, younger men earn less money than older men. They were more likely to have been sexually abused. There was some substance abuse. They did not believe that sexually abusing children harmed children, and they reported elevated rates of distress, so depression and anxiety. We would suggest that these men are probably sort of pre-offenders. They're men who haven't offended yet, but they're at significant risk of going on to offend. And these are a group of men who I think are really in scope for us in terms of if we can get to them early, can we support them onto a healthier sexual developmental pathway? Men who had offended against kids but did not report any sexual feelings towards children, they had some characteristics that distinguished them. They were more likely to be older, more likely to have a child in the household, which is a concern. They had elevated non-sexual adverse childhood experiences. They were more likely to consume deviant pornography. Again, they also had elevated anxiety and depression, and they denied that child sexual abuse was harmful. However, these men were the least distinguishable from men in the community who did not offend. And they actually were not markedly different from other men in the community. I think that suggests that we do have a proportion of men whose offending is linked to situational factors, is linked to other stresses, or is potentially part of a broader pattern of antisocial behaviour, but in and of itself, they're not particularly motivated to abuse kids. And I think for this group of men, when we're thinking about prevention, we're really thinking about situational prevention. How do we keep kids safe from this more opportunistic style of offending? A core group of concern for us was these men with sexual feelings towards children who are offending against children. Statistically, this group of men had a very common cluster of characteristics that we're going to talk about in a moment, but it almost looked like a profile to us. So compared to other men in the community, they were more likely to be married or living with a partner. In the Australian data, they were 3 times more likely to work with children than men who in the community. They had a history of childhood sexual abuse and neglect, elevated depression and anxiety. They also did not believe that sexually abusing children was harmful. They had very elevated rates of engagement with pornography, but particularly deviant pornography. So, for example, this group of men in the Australian data were 27 times more likely to be viewing pornography involving animals than other men in the community. They were also undertaking premeditated activity to hide their online conduct. They were using encrypted social media apps. They were using VPNs. They were using Tor. So they knew that what they were doing online was illegal, and they were taking premeditated steps to hide what they were doing. Although they're more likely to be married or living with the were also more likely to subscribe to romance sites and dating sites. And we know that offenders are using romance and dating apps to target single parents to access their kids. They also had some indicators of substance abuse. So we see in the research, this type of offender is superficially pro-social. They appear to be somebody of good character, and they are therefore able to abuse children for quite a prolonged period without detection. So what are some of the lessons that we can learn from this data? So all 3 of these groups, they had elevated rates of adverse childhood experiences. They held attitudes and beliefs that were permissive of the sexual abuse of children. They also all had higher rates of depression and anxiety than men in the general population. All men with sexual feelings towards kids were more likely to report that they'd been sexually abused as children. These men with sexual feelings towards kids were also more likely to report sexual contact with men in adulthood. However, men with sexual feelings who offend were also more likely than men in the community to identify as heterosexual. And one of the reasons for this is very likely because men with sexual feelings towards children are essentially they are, for want of a better term, sexually more indiscriminate. And we see this in their pornography consumption. They're consuming a very broad range of pornography. It also means that in terms of their sexual contact with adults, they're more likely to report sexual contact with both men and women. This is not about bisexual men. This is about a group of men who, for want of a better term, are sexually dysregulated, often quite hypersexual, so engaged in a lot of sexual activity, and that includes with adult partners of both genders. Men who abused but did not have sexual feelings towards kids had higher levels of non-sexual adverse childhood experiences. But we're also seeing this really consistent message around these men's engagement with online pornography, particularly deviant pornography. We'll touch on that now, and then I want to stop for a conversation. And I'll also just make this point. So when we look at men with sexual feelings who have not offended, and when we look at men with sexual feelings who are offending, really the key distinction between those men was their lifestyle and behavioral choices. Men with sexual feelings who are offending against children, they're married, living with a partner, they're working professionally with children, they're looking at dating, they're on dating sites, they're on romance sites, they're using privacy software to observe their online behavior. So the key factors that these two groups of men were actually their lifestyle and behavioral choices. Offenders were making specific decisions to facilitate their access to children online and offline, and also to inhibit detection. When we look across the three jurisdictions, what we see broadly, particularly in the United States, is the level of online deviancy beyond online child sex offending. So intentionally watching bestiality was much higher in the United States, but also men in the US were much more likely to report that they had friends who they knew were looking at CSAM, who they knew were grooming children, who they knew were webcamming with children. And again, this just goes to that point about the unregulated nature of the internet in the United States and the importance of policy settings. We looked at the proportion of men who sexually offend against children by frequency of online porn use. So again, there's men who abuse children who never look at pornography, but men who were reporting quite frequent use of porn, so daily use of porn, were substantially more likely to also be sexually abusing children. Now, this plays into a whole set of debates about the role of pornography in sexual offending. And we can't assume that correlation equals causation. We can't assume that pornography is making men sexually abuse children or increase men's risk of sexually abusing children. We know that pedophiles, we know that men who do sexually abuse children are frequently hypersexual. It's not uncommon in these cases for men who sexually abuse children. If you look at their online sexual behavior, some of these men are spending 4 or 5 hours a day masturbating to pornography. They have a sexual disorder. So it's useful to look at this. In my work, particularly with non-offending partners of child abuse offenders, so women who discover after the fact that their partner is abusing kids, often the one thing they did know before they knew about his offending against children was they knew he was spending a lot of time online looking at porn. And they often had concerns about the nature of the pornography he was consuming. We looked at the relationship between the men's pornography use, their offending against kids, and their attitudes. And what we found that attitudes towards the sexual abuse of children was mediated. About 2/3 of that relationship was actually mediated by the men's attitudes. So it's not a direct relationship. It's actually that men who believe that it is okay, believe that it's the child's fault when the child is sexually abused, those men are both more likely to consume a lot of pornography, and they're also more likely to sexually abuse children. The strongest relationship was actually in relation to attitudes that deny that the sexual abuse of children is harmful. What's important about this is we actually have a lot of adult pornography that mimics child abuse themes. So the most common and most popular genre of pornography at the moment is incest-themed pornography. So these are adult actors who are acting out scenarios of child sexual abuse. And what that starts to sort of throw into the mix is that potentially adult pornography, where it reinforces the notion that children enjoy being sexually abused, and we do have a substantial amount of pornography that does that, that this bucket of pornography potentially is reinforcing these attitudes, and by doing that is then increasing the risk of child sexual abuse. So I warned you it was a bit of a deluge of data. I'm going now. We've raised, I think, a lot of questions that's worth talking through. We have a number of papers based on this data that's currently under review. So will be public in more detail over the coming months. But yeah, really happy to talk this through with Sati and with you folks.
Michael, I think we probably need another 3 days to unpack this, but that's the rich nature of your research. Wouldn't mind starting at the macro level, if you don't mind, Michael. Some of the things that you report shed light on is the social and commercial determinants of this kind of offending, and in particular the pornography. Wouldn't mind hearing your thoughts from a policy and regulation perspective. What changes do you think we need to make to address these factors and prevent this kind of offending behaviour?
It's a great question. I think firstly, that first 5 to 10 years of life, investing in kids, keeping kids safe. What we know in the United States is that there has been a 50-year turn against investment in public infrastructure that supports kids. So health services, welfare services, family support services, education services, and they are reaping the whirlwind of that. That is clearly having a long-term intergenerational effect on child maltreatment, and it starts to become a vicious cycle. So I think, that investment, early childhood education, early quality daycare, family support services, I think that's really critical. Clearly, when any child is exposed to adversity, that child has the right to the restoration of their health and well-being. But if we don't support boys who have been traumatized, particularly by sexual abuse, and if we don't support their sexual development, unfortunately, there's a cohort of those boys who will grow up to commit other offences. And look, frankly, sexual abuse is not the most common offence committed by a sexually abused boy, but a cohort of those boys will grow up to sexually offend. I think the other point is around the online regulation space, that for those of us who are in child protection, for those of us who are in family support, we really need to, I think, uplift our technological literacy so that we can be a part of those public debates about regulation, and we can clearly articulate to the government, you need to keep the online environment safe for children. You need to address encryption is a problem. Encryption's a massive problem. It's clearly facilitating child sexual abuse. Pornography is a massive problem. And I think child protection really needs to step into that debate, because at the moment, I think the technology sector is outgunning us, and they have a lot more money, and frankly, they couldn't care less about children.
Yeah, that's really concerning what you're highlighting there. I wouldn't mind exploring a little bit more, Michael, that particular population of men with feelings who have yet to offend, because as you've noted, that's a scope that you're pretty confident that we could do some work with. What are you looking at? What are some of the programs or interventions that you're considering with regard to that particular population?
So we have a pilot program of Stop It Now that's running in Australia. It's currently not nationally funded, so it's quite frustrating. And it's an anonymous helpline for people who are concerned about this, people who are concerned that they're a risk to children. Basically call into the hotline, reporting obligations, and they work with the person on the other end of the line to manage their risk. So looking at risk factors and then looking at risk mitigation, and that person can keep calling back, keep kind of working it through. And so this is the kind of service that I think is really important, recognizing that there are a cohort of men with sexual feelings towards kids who are really worried about it, and they don't know what to do. Unfortunately, and the truth is that in Australia and internationally, the majority of men who reach out for help about their sexual feelings have already offended, particularly online. They're already looking at child sexual abuse material. Their motive for seeking help is they are worried they're going to get caught. And they are more, and we've done the analysis in our data, they're more likely to be married and more likely to be employed. So they're worried that if they get caught, it'll destroy their family, it'll destroy their lives, which it will. So those are the men that are reaching out for help. We also need to think about how do we engage earlier, recognizing that the majority of men who access child sexual abuse material over the age of 18 started looking at that content when they were teenagers. And in fact, in our study, 2.5% of men in Australia started looking at child sexual abuse material over the age of 18, but 4.2% started looking when they were kids.
The common denominator for all three of those cohorts that you'd mentioned is the attitudes, these cognitive distortions towards children. But there is a difference in particular in these three cohorts, and perhaps the cohort I'm most concerned about is the third one. They're probably going to be the hardest to detect given their level of sophistication, the skill level, and I suspect they're also going to be the type of offenders who are likely to establish macro systems within the internet that will allow the other cohorts to enter into. So I wouldn't mind you talking a little bit more about that third particular cohort and some of the things that we need to consider at a macro, meso, and micro level when we're dealing with that particular cohort, Mike, if you don't mind.
It's a great question. So in terms of like the attitude of these men with sexual feelings who hadn't offended yet, what we saw in their attitudes was a lot of what's called blame diffusion. So they were really likely to we asked them, maybe people abuse children when they're stressed, or maybe they abuse children because they're on using alcohol and drugs. Or maybe they abuse children because they were abused as kids, and so we asked them this battery of questions. And men who hadn't offended yet but they wanted to, they did a lot of blame diffusion. They were really likely to believe that men who abused children did it for other reasons, but it wasn't their fault. And so for that men, I think you really see them grappling with what they want to do. They haven't done it yet, but they're looking for reasons to do it, and they're looking to attribute the blame to other factors. Once those men were abusing children, the blame diffusion just drops away. And the reason why it drops away is because for them, there wasn't any blame to attribute. They didn't think that they were doing anything wrong at that point. Once they were offending, there's almost like a post hoc rationalization that says, well, this doesn't hurt kids. Kids enjoy abuse. Kids can consent to abuse. So that was really characteristic of the group of offenders. And, we do social norms interventions in other areas of public health. We do social norms interventions in relation to violence against women. This is consent. This is a healthy relationship. This is a respectful relationship. This is an unhealthy relationship. But what we're not seeing is social norms interventions in relation to child sexual abuse. We assume that everyone in the community agrees that sexually abusing children is wrong. Well, actually, for offenders, they have a lot of rationalizations that they could drive a truck through that allows them that attitudinal pathway to offending. They say, oh, well, of course hurting a child is wrong, but I don't hurt children. Those are the sorts of things that offenders come up with. So I am interested in how we do the work to reinforce that sexual abuse is wrong. It is wrong because it harms children, and the responsibility for that harm always lies with the offender. And I think we assume that's a social consensus, but I mean, if you've ever tried to engage services for a sexually abused 14-year-old who's actively leaving out of home care and exchanging drugs for sex, you will routinely hear from professionals in the space, that 14-year-old is making their own choices and consenting. There really is, I think, work for us to do to reinforce where responsibility lies in relation to child sexual abuse.
There's so many ways I want to go after that. I've got a couple of questions, if you don't mind, Michael. I've got a question here from Anne. Do we have a similar service in New Zealand? And I'm wondering whether the service being referred to here by Anne, is there sorry. I'm just opening them up now. Actually, we've got a number of questions here. Do we have a similar service in New Zealand by Anne Venter? And also got a question here from Lisa Joseph. How do cultural factors and impacts for Indigenous people get incorporated into your research or show in outcomes?
So we did collect data on indigeneity, and really for benchmarking purposes. In Australia, First Nations people are actually much more active online than non-Indigenous people. So we had a significant group. We actually had an overrepresentation of Aboriginal and Torres Strait Islanders in the survey. It's not data that we've analysed, and one of the reasons for that is we need to broker a data partnership with Aboriginal researchers to do that work, because it's incredibly, as you can imagine, it's incredibly sensitive work. The other issue that we have is that beyond, and I respect the question you've asked about First Nations, but essentially for any community in the country that has higher rates of adversity, we're going to see this cycle. And so we've been really careful not to report in any way on cultural background, because it, to a certain extent in our data, distracts us from the fundamental questions around the social determinants, which are true for all communities, although some determinants and risk factors are clustering in community. So I probably haven't answered your question, but we also didn't have a First Nations researcher on the project. And the survey wasn't, in that sense, it wasn't designed for First Nations communities. And so we are thinking quite seriously about what to do with the data set around the First Nations participants, but also recognising we're not the best data custodians for that work.
Yeah, I love that, Michael, and I think that's particularly pressing for us in Aotearoa New Zealand for tangata whenua in particular, and also Pacific and ethnic communities who disproportionately are impacted by this level of sexual violence and family violence. So, but I appreciate that you're approaching in a very culturally sensitive manner, and you're considering the appropriate approach with regards to that. Also got a question here around, are there any good examples of helping parents and families understand the red flags and harmful attitudes that you were referring to earlier, Michael?
Yeah, I think, Australia, we've seen significant investment in services around sexually harmful behaviour amongst teenagers in particular. Quite a lot of money's gone into that in the last 10 years. And so we're seeing clinical services really expand capability, which is great. And I think when we look at models of care for kids engaging in sexually harmful behaviour, the outcomes are really strong. They're really good. And I practice frameworks that have been developed are delivering really good outcomes, because we're just not seeing those kids go on to offend as adults. And so the clear message is, I think that early intervention work is really critical. I think on the basis of our study, I think there's other conversations to be had about, when we talk about sexual health, we're often talking about sexually transmitted infections. And I think we need to talk about sexual health in terms of, if you're masturbating to pornography 4 hours a day, if you find yourself aroused by quite deviant material, you need to come in. And frankly, we need to offer you a service, which very often at the moment we're not. But how can a young person or a young man self-refer? And there's a big gap for us once they're over the age of 18. So a 19 or 20-year-old boy whose behavior is really quite sexually disordered, but he hasn't committed an offence, he is really, at the moment in Australia, unable to access a service around his sexual health. And we lack a clinical workforce that has the skills to do that work with that young man. But I think off the back of our survey, there are clearly some more risk factors that we need to take into account to say, this is sexually really unhealthy, and we're prepared to support your sexual health in a different sort of way.
Yeah, I love that, Michael. I can't. What you're really highlighting and reinforcing is the need for having a really explicit conversation around this kind of offending behaviour. And explicit conversations in all workplaces. Because I'm thinking about the research that you've shown. A lot of the men are 3 times more likely to be working with children, right? So in terms of protecting and in terms of the vetting process through employment, we need some explicit conversations that actually allows us to actually, and makes it very clear for someone entering into employment that these are the things that are being considered. And I can't help but and again, I'm going to go off into tangents, rein me back in. I can't help but think about this whole idea of self-deception that you and I, Michael, had spoken about earlier on, and how that level of self-deception could be easily become. And I know there's a technical word for it. There's a technical word called bullshitting. There's actually a technical and a philosophical and psychological works around this idea of bullshitting. No commitment to the truth, but it's making salient things that have nothing to do with the truth. And that's the sense, as a practitioner working with child sex offenders, this is their way in which they approach things. There's this bullshitting approach where they're making salient the fact that they've turned up on time, they're doing all these things, but they as a ploy to avoid having a conversation about the internal world and some of the things that they're processing. And so I'm also concerned about this movement around the argument that pedophilia or this kind of feelings towards children is a sexual orientation. Because there's been an argument that this is a sexual proclivity, which is absolutely not the case in my mind. But I'm concerned about that level of self-deception, and if people are going into that, and people working with child sex offenders could get caught up in that, if that makes sense, Michael.
It's actually got a paper on this topic coming out in the next few. It's really important to understand that the pro-pedophile movement, and there's been organised pro-pedophile movements for about 50 years. When the LGBT movement arose in the 60s and the 70s, there was quite active attempts by pedophiles to compare themselves to LGBT people. And that's really been their primary mode of trying to find social legitimacy for half a century. Unfortunately, I think we are seeing a certain naivety amongst a group of psychologists, both academic psychologists and also forensic psychologists, whereby men with sexual feelings towards children are making these descriptions about and identifying themselves as having a sexual orientation rather than a sexual pathology. And I think, unfortunately, for some psychologists, they just don't understand. Actually, this logic does not come from nowhere. These men did not just make this up. They've been online, they've been reading the literature, they've been engaging with social movements of pedophiles. And some of those social movements are quite public and quite easy to join. They're on social media, they're on discussion boards and so on. And so we're starting to see in the forensic psychology space a laundering of pro-pedophile social movement rhetoric into the scientific literature. There's a couple of things to say here. We asked about sexual orientation in our study. And in fact, there was no between identifying as gay or bisexual and sexual feelings or offending against children. In fact, the only association was that men who are using children feelings heterosexual, despite the fact that they were also reporting high rates of sex with men. What we see in our data is a clear sexual pathology. We see men whose sexual development has been impacted by childhood adversity, men whose sexual development has been impacted by a really unhealthy online environment, men whose sexual arousal patterns are not limited to children at all, but include really deviant material. We see in our data a sexual pathology. If what we saw was a sexual orientation, that's what I'd be telling you. But I don't understand how we can possibly make that argument that these men, all that they have is, you know, they were born this way, they're interested in kids, there's nothing they can do about it, when we're looking at a broader pattern of sexual pathology that desperately needs treatment. Yeah.
Well, I love that. Thank you. You know, we could go on for hours if I had my way, but unfortunately we don't, Michael. Could I just ask this question from Maria? What are the key protective factors to prevent child sexual offending?
Again, I think it's a great question. I will say we focused on risk factors rather than protective factors. That's a potential weakness of the study. But, you know, there's childhood experiences, but there's work on protective childhood experiences as well. You know, we know that kids who experience adversity, there are ameliorative factors in their lives. You know, having a protective adult, having good attachment systems. You know, there are so many ways in which adversity, it doesn't just, you know, lay down negative impacts and then you just have to live them out. You know, there are so many ways in which the effects of childhood adversity are reversed. There are so many ways in which they're neutralized by positive influences in a child's life. And that has to be our takeaway. If we build and invest in strong families, strong communities, if we support people to be the sorts of parents they want to be, if we support families to be the sorts of families that they want to be, we're going to see a reduction in child sexual abuse amongst a range of social problems. And I would also say we have to hold the technology sector to account. They are responsible for driving a significant increase in certain sorts of perpetration over the last 20 years. And there's lots of positive effects of the internet for kids, lots of positive effects. And we've done, you know, there's lots of work measuring that, and we need to hold on to that. At the same time, insisting you can't deliver a service into our country that carries with it a predictable risk that that child's going to be sexually abused or a cohort of kids is going to be influenced to sexually harm others.
That is such a powerful message of hope, first of all, Michael, but also you've really highlighted and underscored to me the role of technology in this. It is, I mean, we already knew through social media that we had some concerns around, I mean, just in terms of mental health, but I had no idea of the significance and the contribution of technology in terms of this kind of behavior. So I really appreciate that you've made salient those things. Just want to thank you again. Like I said, I wish we had more time, Mike, but just appreciate, first of all, your passion, the wonderful work that you're doing, and we're hoping that this will not be the last time that we have these conversations, Michael. It has been such a pleasure, and I'm hoping that the other questions that we have here, we could send them through or perhaps explore them at a later date, please, Michael. But once again, thank you so much. It has been fantastic connecting with you and having a conversation with you. I'll hand it over to Cheryl now. Thank you, Michael.
Kia ora, Michael. Thank you so much for sharing that with us. Really important information for our work, and I'm sure people will go back, have a look at this video again, look at the slides and all the data, and we can put some links to your research too. So we just want to thank you so much for your time, and we really appreciate it. Thanks, Sati, as well, for your great questions, and everybody who posted in the Q&A. We hope you found it really useful, and we'd really appreciate your feedback or any ideas that you have for future sessions. Just a reminder that our next session in September, Wednesday the 18th of September at the same time, 12 noon, we're going to welcome Dr. Claire Gear and her team who worked on the Atawhai project, which explored the effective responses to family violence within the health primary care settings. So you can join her and the team next month, sorry. I'll close with a karakia, and thank you so much. Kia tau te rangi Māori e, ki runga ina iwi o te ao. Haumi e, hui e, tā iki e. Kia ora, go well everybody.